So today I have Dr. Gary Hardy with me to talk about an interesting topic of autoimmune diseases and how it can be addressed. Dr. Hardy has been practicing for 30 years in the field of chiropractic therapy, naturopathy, and homeopathy. In fact, he was one of the founding members of the Canadian Academy of Homeopathy. And it's a pleasure to have you here.
Well, thanks, Beverly. It's nice to be here.
Yeah, likewise. Now, with so many experience in all three modalities, is there one that you gravitate towards, or do you apply all three equally?
Well, I can tell you this, is that in my second year of chiropractic college, I knew at that time that I wanted to go further into naturopathic medicine. And by the end of my fourth year of chiropractic college, I knew I wanted to specialize in homeopathy, and that's exactly what I did do. So with homeopathy, because it has such a wide range of action, that's why I decided to take homeopathy as being the forefront in terms of therapeutics. Nutrition became secondary, and then everything else I sort of used as tools, like a tool belt. So I would use spinal manipulation, I would use botanical medicine, I would use acupuncture, supplements, and lifestyle counseling, but these are all tools that I would use in addition to homeopathic medicine.
Wow, so pretty much if anybody came to you, you pretty much got everything else covered.
Yeah.
Now, in the cases of autoimmune diseases, which you have plenty of experience with, for many, they perceive it as, well, there's nothing they can really do about it. So maybe you can briefly touch upon what makes a disease autoimmune.
Well, there's three things that have to be present in order to have an autoimmune disease. The first one is you have to have a genetic susceptibility. Second thing is you need an environmental trigger.
Oh.
And then the third thing is you need something called increased intestinal increased intestinal permeability.
Mm-hmm.
So an environmental trigger would be something like an emotional stress can trigger it. It can be bacterial or parasitic infection in the gut, or it could be a food intolerance such as gluten or dairy. Those are the things that can act as an environmental trigger. And then something called increased intestinal permeability. Common name is called leaky gut. So it's kind of like, if you can imagine these four fingers here being your intestinal lining, the intestinal epithelial cells. And if you could imagine that in a normal healthy gut, these four cells are bound tightly together. So in a healthy gut, normally carbohydrates are broken down to simple sugars, or proteins are broken down to amino acids, and they're very easily digested and pass through these intestinal epithelial. But when we have an inflammation that takes place, this tightly bound intestinal cells begin to get little leaks. So they start breaking apart. When they start breaking apart, then what happens is the proteins are not completely digested, and so you get these still larger proteins that are able to pass through the gut lining. When they pass through the gut lining and it gets into our bloodstream, our body automatically recognizes that as something being foreign. So what happens is you have two things. The body produces these antibodies that start attacking the tight junctions here, and they start attacking those dipeptides, those things that we're able to pass through here. And then what happens is there's a cross reaction with those dipeptides, and it starts attacking our body's own tissues and organs. And so depending on the site of where that inflammatory process takes place determines the type of autoimmune disease. So if it's in the myelin sheath of the central nervous system, we call it multiple sclerosis. If it's in the synovial fluid, we call it rheumatoid arthritis. If it's in our intestines, we might call it Crohn's disease or ulcerative colitis, depending on what layer of the tissue that's involved. So if it's in the thyroid, we would call it Hashimoto's, or another disease called Graves' disease. Mm-hmm. So there's over 80 different autoimmune diseases that are out there.
Wow. What's the percentage, if my family has it or someone's family has it, of it being passed down?
It depends on the type of autoimmune disease.
Right, okay.
And it depends also on the susceptibility, how many family members have an autoimmune disease. And it just doesn't have to be one autoimmune disease. one of the things that is noticed out there that a person, say if there's a history of depression or bipolar disease, and there's a history of perhaps vitiligo or Crohn's disease or any of these other autoimmune disease, the more family members that are there, you have a higher susceptibility of developing further autoimmune diseases. And the thing is that this is probably extremely important. That is, if you develop one autoimmune disease, you have a higher chance of developing a secondary or third autoimmune disease.
Oh, wow.
Yeah. And predominantly 2/3 to 3/4 of all the people who develop autoimmune diseases are women.
Oh, that's not good for me.
Nope. Nope.
No. What type of cases do you see most through your office?
In my office, I see patients with multiple sclerosis. I see Crohn's disease, ulcerative colitis. I see lupus. I see patients with psoriasis, a wide range. Meniere's disease. And a good example perhaps would be that, when someone comes in with one autoimmune disease, there's a very strong likelihood that they come in with, someone might come in with a mixed connective tissue disorder, so they have, like lupus, Sjögren's, and rheumatoid arthritis, all in one person.
Oh my gosh.
Yep.
Wow. Well, I'm pretty sure they'll be safe with you, with the amount of knowledge you have. In what ways can complementary medicine help a person's quality of life if they are living with autoimmune?
Well, it depends on what stage that we see the person coming in with. If I've got a person coming in with, say, Crohn's disease, and they've got maybe a partial removal of their bowels, I can still be able to reduce the inflammation and get them back on a relatively normal, healthy life. So we can stop the inflammation, we can stop the blood, the mucus being produced. They can start having normal bowel movements again and can lead a healthy life. But on the other hand, if you've got someone having total bowel resection, there's going to be some impairments, but you can still be able to return them back to their health again. So I see people both the extremes, and I see also people in acute stage where they are coming in and they're having blood and mucus, and we can still stop it and be able to reverse the process.
Oh, that's good news. So it is reversible.
Yes.
Great.
And even with cases with multiple sclerosis, we can do a lot for them up to the stage where they have what you call relapsing remitting stages. So from the early stage of MS up to the relapsing remitting stage where their symptoms would come on and then they'd clear up, come on and clear up. Up to that stage there, we can get excellent results with MS. When they start getting into the progressive stage where there's no relapsing remitting stage anymore, when it becomes progressive, that's where we have a problem, because if you were to say have numbness and tingling, say in the arm, say for longer than a year, year and a half, more than likely that's going to be permanent because you have scarring taking place. And so usually when you have the scarring taking place, that symptom tends to be irreversible.
Oh.
So there are, depending on the disease, just like rheumatoid arthritis, someone comes in with severe arthritic nodosities and you can't do anything with the actual tissue change that's taking place, but what you can do is be able to reduce the inflammation and the pain.
Okay. Have you ever worked with MDs to work on a case, or usually? Usually
people have already gone that route.
Oh, gotcha. Yeah.
Majority of people have already gone that route, and they're coming to me as a result of it doesn't seem to be working. So.
Okay. Well, you seem to be doing really great work.
What I would like to do, and in some cases too, I shouldn't say that, in some cases I've been referred by medical doctors as well, because I've treated some of their patients, and so it's not always just an isolation. I prefer as well to work with medical doctors, and especially when there's medications, as the patient begins to improve, I refer him back to the medical doctor so he can gradually decrease the medications. So.
There's that transition phase.
Yes, because I think it's really important to work as a team.
Yeah, I completely agree. Well, thank you for all that information.
You're welcome.